Hello everybody. Today we are going to discuss about mucormycosis, the prevention, early diagnosis and early treatment. I am going to share with you the videos and the observation which I had collected in last 1 month. The sequence of event in these patients, it starts with immunosuppression. Then the opportunistic saprophytic infections get a chance to grow there. Then when you get mixed infections, when there is a stasis in your nose and lungs, you've got mixed infection, all sort of fungal infection, they are there to grow. Then there is mucosal erosion. I'll show you this in the videos where I had seen the patients in the initial stage. You will see that mucosal erosion is there. When I remove the mucormycosis, when I do it endoscopically, when I remove the mucormycosis, you will find the erosion of mucosa. The mucosa is not there. The bare bone is there. So there is bone destruction. This is in the early stages. Then it progresses later on to some sort of gangrenous changes. It may be due to arterial blockage, yes, definitely, because that gangrenous changes in the tissue makes it a little slightly darker. I'm going to share the videos where you will see mucormycosis in different stages. In different patients, you will see initially this mucormycosis appears to be white or yellowish white. Then this changes its color to light brown or brownish red, and then it changes to reddish black type of color. But initially, so many cases, we had seen so many cases where in initial stages it was just like a slightish white, off-white or yellowish white color which was appearing in the nose. In nasal endoscopy, it was very easy to diagnose the case. And I had seen cases where I had just removed the mucormycosis, the time at which I was doing this endoscopy, I had removed that small tissue which was there, that small necrotic material which was there. And it was easy, even without anesthesia, just spraying the nose with 10% of xylocaine, I was able to remove it. Especially when the patient, I had asked the patient, we had done a lot of gel neti or nasal saline spray we had used. Then after that, I was able to remove this mucormycosis even with a suction, though it is very hard initially, but when we were putting some sort of nasal spray, then it was getting slightly, it was changing the consistency and we were able to suck. You can see this in the video. Then we were able to even remove it completely doing this nasal endoscopy without any anesthesia. But this only happens in the if you do the early diagnosis, you can remove the mucormycosis completely. The most important thing is early diagnosis by nasal endoscopy. Apart from this, when you are removing this mucormycosis in these patients, you see bony erosions, you see erosion of mucosa. After removal, there is a recurrence. I had seen in 2 of my cases, there were small spots of recurrences. Then I started using liquid, this amphotericin B with liquid paraffin. I had sprayed the nose in MACA position, and the patient, this spray, after this spray, he was doing a sniffing and he was carrying all those drugs to those areas within the middle meatus and everywhere in the nose. And I got a very good result in few patients where I had done initial diagnosis, early diagnosis. And this spray was very useful because amphotericin B is a drug of choice for mucormycosis, and it is very effective in controlling these early stages. If you want to prevent mucormycosis, most important part is to understand why the cause of mucormycosis, why it is spreading so fast, why in post-COVID cases or in general population these cases are on rise. We all know that it is multifactorial, and I will just enumerate the probable causes which we had seen in last couple of months. First thing that I'm going to discuss with you is the irrational use of antibiotics, both in normal patients, in persons who are in quarantine for COVID-19, or in patients who are admitted in ICUs. There we had used more than one antibiotic, though it was required, but irrational use of multiple antibiotics, it has caused a havoc. And you all know that if we are using antibiotics, we have got this type of opportunistic infections even in our ears. I'll share a serial video where different type of fungus grows in ear once we are on high antibiotics or we are putting antibiotic ear drops. Then, apart from the irrational use of antibiotics, the second most probable cause which is coming up, surfacing, is the use of steroids. Here we must remember the irrational use of steroid is more of concern. If you see, we adjust the dose of steroid, we adjust the duration of steroid, we adjust the timing of steroid, and fourth thing is we adjust the tapering of the dose of steroid. These are four important things. In India, it is very difficult to control or to formulate a simple guideline for people because there are so many quacks who are administering this steroids right, left and center. Then there are people who are prescribing, giving steroid off the record. Then there are so many patients who are self-administering this steroid. This all happens in India. And we are using inhalational steroids. We have to keep in mind the continuous use of inhalational steroid, though they are necessary in huge number of cases. Here, you always remember that we were using steroid previously either for COPD or for kidney transplant patients or for rheumatoid arthritis and so many conditions, chronic conditions. There we were using a controlled dose of low dose of steroids. And even if we are using moderate doses, we were taking care of the glycemic control, and that was very perfect. Apart from this, you see, one of the most important causes of mucormycosis occurring in patients who were admitted in ICU were the dryness, formation of crust in the nose and upper airway. It was a major cause because this causes a stasis. When the secretion dried up, the mucus blanket which is going posteriorly in the nose, we are hampering this natural physiology. It is the most beautiful normal physiology in which we never have any growth of mucormycosis because there is a continuous movement of mucus blanket from the nose into the pharynx and then we are swallowing it. Similarly, from the lungs it is coming up and when it reaches the pharynx we were swallowing it. So that physiological prevention of mucormycosis, which is happening regularly in each and every individual, that when we were having dryness, we were having crusting in the nose, that particular thing, we had lost that normal physiology in those cases who were there in the split ACs, in those atmosphere where there was very less moisture. And it is one of the very important causes where people with dried up secretions, with stasis either in nose or in the upper airways.
One thing that is noted with this new strain is that we are having more depressed immunity.
One more thing I'd like to add in the causes of mucormycosis is that was severe anxiety. It depresses your immune system. It causes immunosuppression. Anxiety factor is very important, and we had seen anxiety in normal population, in patients and serious patients. It was so much that their glycemic control was very difficult. Anxiety increases the blood sugar levels, we all know that. Thank you.